Good evening. I'm Renee Cooper. Thanks for joining us for KX News at 10. Leading our coverage tonight, Governor Burgum says the state is working diligently to raise hospital capacity. North Dakota officials began outlining worst-case scenarios to include building temporary hospitals in Bismarck and Fargo after health officials confirmed the highest number of COVID-19 cases in a 24-hour period today. He laid out possible models and possibilities for the rate of spread in the state. The governor says when we look ahead 3 weeks, we could be at a 6 to 13 time increase, meaning 600 positive cases or up to 1,300 positive cases. He added modeling should become more precise once the state tops 100 cases. Burgum says the numbers could be on the lower end of the model if North Dakotans follow the directives given, including executive orders and other recommendations.
Will we take advantage of the extra time we had to learn and look what other states have done, and will we change our behavior accordingly? Or will we presume that, hey, because it isn't here yet, it's not going to come here, and then we'll continue to ignore orders that will, hasten, if they ignore things that would, and do activities that would hasten the spread, or will we actually be smart enough to utilize our lead time to change the behavior?
When we plan on hospital capacity, Burgum looked at other states and countries where about 20% of positive cases needed hospitalization, and about a quarter of those cases need intensive care treatment. North Dakota National Guard Major General Alan Dorman says the Army Corps of Engineers will be here next week to look at possibilities for hospital capacity and other planning, including a look at medical equipment. Right now, there are 408 ventilators in the state. For the first time in several days, Burgum did not unveil any executive orders. However, State Health Officer Mylan Tufte issued a confinement order for people coming into the state from out of the country or from 23 states with widespread community cases. Those people must stay at home for 14 days after arriving in North Dakota. Well, Governor Burgum announced 26 new cases of COVID-19 today in North Dakota. Total positives now sit at 94. There are now 16 people hospitalized, and 18 people are listed as recovered by the North Dakota Department of Health. Governor Burgum says he believes for every one person who tests positive, there are probably another 10 positive cases that have not been tested. Burleigh County sits with 28 positive cases, 18 in Cass County, 13 in Morton County, 9 in Stark, and 7 in Ward County. There are now positive cases in 18 of North Dakota's 53 counties. A total of 2,892 tests have been conducted to date. Well, nurses across the country